Hello and welcome. Today we're diving into a common condition affecting men, balanitis. This inflammation of the glands or head of the penis can cause discomfort and concern, but understanding it is the first step towards effective management and prevention. Let's explore what causes balanitis, its symptoms, how it's diagnosed, treated, and what you can do to keep yourself healthy. So, what exactly causes balanitis? The most common culprit is infection, particularly fungal infections caused by Candida, the same yeast responsible for thrush. However, bacterial infections, certain sexually transmitted infections like gonorrhea or chlamydia, and even viral infections can also be responsible. Beyond infections, poor hygiene is a major contributing factor. Inadequate cleaning under the foreskin can lead to a build-up of smegma, which irritates the glands. Irritants like harsh soaps, detergents, and even some spermicides can also trigger balanitis. In rarer cases, balanitis can be linked to underlying skin conditions like eczema, psoriasis, or reactive arthritis. Let's delve into the pathophysiology. When an irritant or infectious agent comes into contact with the glands, it triggers an inflammatory response. This response involves the release of inflammatory mediators, leading to vasodilation or the widening of blood vessels, increased blood flow to the area, and the infiltration of immune cells. The skin becomes inflamed, red, and swollen. In cases of infection, the causative organism multiplies and further exacerbates the inflammation. This inflammatory process disrupts the normal skin barrier, making it more susceptible to secondary infections and further irritation. In chronic or recurrent cases, the inflammation can lead to skin thickening, scarring, and even phimosis, where the foreskin becomes difficult to retract. Balanitis is relatively common, affecting an estimated 3–11% of men at some point in their lives. It's more prevalent in uncircumcised men, particularly those with poor hygiene. Individuals with diabetes are also at higher risk due to elevated glucose levels in the urine, which can promote the growth of Candida and other microorganisms. While balanitis can occur at any age, it's more frequently seen in younger men and older men. In children, it's often associated with diaper dermatitis or irritation from clothing. Understanding these epidemiological factors can help in identifying individuals who may be at increased risk and tailoring preventive measures accordingly. Recognizing the signs and symptoms of balanitis is crucial for early intervention. The most common symptom is redness and inflammation of the glands. This can be accompanied by itching, burning, and pain, especially during urination or sexual activity. There may also be a discharge from under the foreskin, which could be white, yellow, or even greenish depending on the cause. The skin may appear dry, cracked, or thickened. In some cases, small sores or ulcers may develop. If phimosis is present, retracting the foreskin may be difficult and painful. It's important to note that the severity of symptoms can vary depending on the underlying cause and individual factors. If you experience any of these symptoms, it's best to consult a healthcare professional for proper diagnosis and treatment. Diagnosing balanitis usually involves a physical examination of the penis. The doctor will look for signs of inflammation, discharge, and any underlying skin conditions. They will also ask about your medical history, including any history of diabetes, skin conditions, or sexually transmitted infections. In some cases, a swab of the affected area may be taken for laboratory testing. This can help identify the specific organism causing the infection, whether it's Candida, bacteria, or a virus. If the doctor suspects an underlying skin condition, a biopsy may be performed. It's also important to rule out other conditions that can mimic balanitis, such as penile cancer, which requires a different diagnostic approach. A thorough examination and appropriate testing are essential for accurate diagnosis and effective management. While balanitis is the broad term, it can be further classified depending on the cause or specific presentation. Zuhn's balanitis, also known as plasma cell balanitis, is a chronic inflammatory condition typically affecting older, uncircumcised men, characterized by a shiny, red, or orange plaque on the glands. Sursonate balanitis is often associated with reactive arthritis and presents with small, painless ulcers. Pseudoepitheliomatous keratotic and mycaceous balanitis is a rare condition characterized by thick, scaly plaques. Differentiating between these subtypes can sometimes be challenging, and a biopsy may be needed for definitive diagnosis. However, most cases of balanitis fall under the general category of infectious or irritant-induced inflammation. Treatment for balanitis depends on the underlying cause. For fungal infections, antifungal creams, such as clotrimazole or miconazole, are commonly prescribed. Bacterial infections may require topical or oral antibiotics. If irritants are the cause, avoiding those substances and using gentle, fragrance-free cleansers is essential. Corticosteroid creams can help reduce inflammation and itching. In severe cases, or if phimosis is present, circumcision may be considered as a last resort. Maintaining good hygiene is crucial for all types of balanitis. Gently washing the penis with mild soap and water and thoroughly drying it can help prevent further irritation and infection. It's also important to address any underlying conditions, such as diabetes, to improve overall health and reduce the risk of recurrence. Always consult with a healthcare professional for personalized treatment advice. Prevention is always better than cure. Practicing good hygiene is the cornerstone of balanitis prevention. This includes regular washing under the foreskin with mild soap and water and thoroughly drying the area afterward. If you have diabetes, keeping your blood sugar levels under control is essential. Avoid using harsh soaps, detergents, and other potential irritants on the penis. If you are prone to fungal infections, consider using antifungal powder or cream after showering or swimming. For uncircumcised men, regular retraction of the foreskin for cleaning is important. If you experience recurrent balanitis despite these measures, talk to your doctor about other preventative options, including circumcision. By following these simple steps, you can significantly reduce your risk of developing balanitis. The prognosis for balanitis is generally good, especially with prompt and appropriate treatment. Most cases resolve completely within a few days or weeks. However, recurrent episodes are common, particularly if the underlying cause is not addressed. Recent research has focused on understanding the role of the microbiome in balanitis and identifying new antifungal and anti-inflammatory agents. Studies are also exploring the potential benefits of probiotics in preventing recurrence. Additionally, there is growing interest in minimally invasive surgical techniques for treating phimosis associated with chronic balanitis. As research continues, we can expect to see even more effective and targeted treatments for this common condition. Remember, if you have concerns about balanitis or any other health issue, always seek professional medical advice.